Hi, my loves.
Hey, sugar.
We want to introduce you to our new channel, or our newest show on our PIFEST channel.
That's right, y'all. So this is the maiden voyage of ramblings,
musings,
and some serious shit.
So you guys asked for it.
God help you. And some of you threatened and bullied for it.
So we're finally here. We're going to need you to subscribe,
like,
and follow. Because y'all made us do it.
That's right. And y'all know, because it's not like you're new to that you're new to YouTube. Hit that notification button. So that way you're notified every time we have a new rambling or musing or we talk about some serious shit.
We've contemplated how to do this for you guys so that it's totally something that's organic for us. And we're bad at the social media. You already know. We are not the savvy people. Y'all gonna work with us. One day we gonna look like the queen of all of this. But in the meantime, y'all gonna get you're gonna be like, oh yes, I remember the first episode when they barely had all the bells and whistles. But y'all stick with us because we will be bringing you some really great content because it's Adina and Lo.
Exactly. So that's
why you've been asking us for it.
You really, really have. And the way we figure is, if y'all are anything like us, which y'all are friends and fam, and some of y'all are soon to be new friends and fam, let's face it, you spend a lot of time listening to a lot of mofos talk about a whole lot of nothing. So what's one more?
At least we'll be talking about something.
Exactly. And oftentimes that's something gonna be some serious shit that you're gonna want to tune into.
Listen, you're gonna want to turn into the ramblings too, and the musings.
Absolutely. Trust me, you're just not gonna want to miss any of it. So while you're doing all the things we asked you to do, also don't forget to share. The doors of the church are open. Come one, come all.
We always want you to share.
Exactly.
Share, like a Care Bear. Oh, the Care Bears. Woo, child, the Care Bears keep coming through.
Listen, stay tuned. All my, people who grew up in the 80s and 90s and whatnot, there will be an episode. Foreshadowing.
Oh my God. We might have to get that guy from Costa Rica with the Care Bear song.
Y'all will love that story.
See, y'all don't want to miss an episode. So, but let's get into it. Our first episode is some
serious shit. Our first episode, we are very fortunate to have Dr. Jilliann Elliott, who came on and spent some time with us and talked with us about the COVID-19 vaccines. And she covered a number of bases and a number of questions that a lot of folks have about efficacy, about safety, about people's concerns. There's a lot of folks, especially in the Black and Brown community, who have some reservations about the vaccinations. Some of them absolutely are founded, far be it for us to poo-poo anyone's feelings. But some of them, y'all, let's just be real, you're being ridiculous. So she does a lot of myth busting because that's the most important thing. We want you to make educated decisions about your health.
And we're looking out for us.
Yeah, because we want to see you. We want to do shows. We want to hang out with you. We want to spend time. And let's face it, we can't do none of that shit, with the COVID running rampant. Not at all. So y'all, we're about to get into it without further ado. It's our pleasure to present to you Dr. Jilliann Elliott, who is going to break down all the things that need to be broken down so that they forever be broke.
So we're about to get it popping, and it's going to be informal and informative. So welcome everyone to episode 1 of Ramblings, Musings, and Some Serious Shit.
Yep.
We are here with Dr. Jilliann Elliott. Are you Dr. Jilliann M. Elliott?
No, just Elliott.
That's just Dr. But she's just Dr. Jilliann.
Exactly.
Right.
So, we and luckily it's all peeps here. So we're gonna be real informal. And we're gonna get it popping. So
yeah.
We are talking.
We're going to be informal, y'all, but we are going to be informative. That M, renaming Dr. Jilliann, that M is you must be out your damn mind if you are in these streets and not following COVID protocol.
Exactly.
How about that?
Yeah.
Minds together. Thank you so much and God bless.
So just a quick little intro for you guys who are checking us out. Lorenza and I, we were sitting around, we were talking about all the things that are going on in our community about the COVID vaccine and us not getting the shot or being disproportionately low in getting the shot. And what is that all about? And I was like, you know what? Let me call my neighbor, Dr. Jilliann, and see if she could come on and talk with us. And I knew that she had just put out a little video, which we're going to show you in a little minute, a little commercial for the vaccine. And I was like, come on, can you come on and talk to us and just be chill? So we're here. We're going to be giving out some questions that we keep hearing. And Dr. Jilliann is going to tell us some things that she knows. And that's how it's going.
Right. So we are going to actually do this so-called interview in a slightly inverted fashion, y'all. We're going to let Dr. Jilliann go ahead and actually speak to you because we also discussed that most likely she's going to end up covering whatever questions we might have had or that y'all might have had. And so rather than force her into the space of redundancy, which is already par for the course for her, dealing with folks and in general, and then dealing with this specifically, we're going to let the floor be hers. She's going to tell you a little bit about herself and what she knows, what she wants us to know, and information that is actually viable and helpful. So I know y'all love the Twitter and the book face and the Instagram and all that mess like that there, and the Google and the WebMD. None of those are actually your viable resource for actual information as it pertains to this. I promise you, your auntie and them are not epidemiologists. You may not want to, I know she puts peroxide on everything. You may not want, I know, lemon in your water, great. The sauna, the hot shower, I know, I know, but no. Vitamin D, and yes, even that one that some of you all are really deficient in. No. Okay. So Dr. Jilliann, let's hear it.
I love that. Yes. Even though she gives you ginger.
All the time. For everything.
Everything. Oh,
everything.
Have some ginger tea. It'll cure everything.
A little rum.
A little rum, a little ginger tea, fix everything.
My mom cured my chickenpox with just rubbing Ray and Nephew on me. So that was her cure, her old school Jamaican nurse cure.
That's funny. Chickenpox and when a baby is teething, just
till this day, I smell Ray and Nephew. I'm like, oh no, I'm itchy. So I mean, and that's what I said in the video that you'll show a little bit later, that you gotta not listen just to the jibber jabber or the bonchiche or whatever it is that you're hearing from, this person and that person. Actually redo your research and figure it out for yourself. Check the receipts and actually understand it. So just a little bit of background. Going way back. My parents are, from Jamaica immigrants, came over here, raised 2 daughters and a son. 2 daughters became both physicians. I was living in the Bronx for most of my time. And then we were by eating more projects. It was getting crazy. My mom said, okay, we gotta move. We're gonna move upstate. And I was like, cool, Mom, where are we moving? She was like, we're moving to Yonkers. So I didn't go far. I did residency over at Montefiore. My mom was a nurse at Monte. My sister did residency at Monte. We all were trying to just like, you know, keep it within the community and stuff. And I worked there for a while, then Sleepy Hollow. Now I'm out down at Mount Sinai, taking care of 9/11 responders. But you know, this is something that I deal with on a regular basis, you know. Everything that I'm saying here now is just all of my own experiences, what I've learned, what I've researched, and everything else, not speaking on behalf of Mount Sinai or nothing, but just the real shit, the real talk, so that we can understand this a little bit better, you know?
Awesome.
Yeah. So
I had to laugh when you were talking about moving upstate. That's such a New York, that's such a city thing to say. Westchester is so upstate. I'm like,
you live upstate. I'm like, I live a whole 10 minutes outside the Bronx. What are you talking about?
I was like, I think Albany's upstate.
Yeah, exactly.
I'm certain of that.
I literally could walk to Yonkers from where we lived in the Bronx. I was like,
of course you could.
I walked to the Yonkers, Mom. What are you talking about? We're like right there.
Right.
But
you're upstate.
Okay. So I have conversations all the time with my patients about the vaccine. I am very, very adamant about, you know, trying to get the word out, trying to get our Black and brown communities vaccinated some more. You know, we are dying at a much higher rate than other races. And it's a sad, you know, state of affairs. Just last week, my friend lost her partner of over 20 years. He was diabetic, African-American, and almost right in front of his own daughter and her, he lost his life. Ooh. And it just hurts me because I think to myself, if I maybe was able to get to him and just try to get him vaccinated a little bit sooner, maybe he'd be here and stuff, you know? So stories like that just get to me and really bother me because there's something we can do about it, you know? Mm-hmm. There's an option there, and it's sad that some people are opting not to take it because of misinformation, you know? So that's basically why I want to try to clear up, get the myths gone, and just answer, you know, as many questions as possible, you know?
Awesome. So, yeah, this will then be turning into the Black girl magic version of MythBusters. I don't know if any of y'all are geeks out there. If you're friends of ours, you're a geek, which means you liked MythBusters. And so we about to bust the myths, and the myths we're going to bust will hopefully inspire you, educate you, so that you will do what is in the best interest of your health and of the health of your loved ones and those that are near and dear and those who are around us. Dr. Jilliann, I'm sure you can speak to this absolutely with greater insight and authority. But I think that one of the things that has troubled me so much about even the way in which the pandemic has been handled in our country, specifically the United States, I'm not going to turn this into a political thing. But unfortunately, one of the first things we all heard was, you know, wear a mask to protect others. And I was like, well, Americans are selfish. If you had just said protect yourself, everybody would have had protect their neck, like Wu said, and had their grill covered. But you're like, oh, somebody else. I don't give a damn about nobody else. Yeah. So can you help folks understand even something as basic as that? Because I still see people walking around and, you know, and the mask piece is down here.
Oh my God, it drives me nuts.
Which I'm like, well, just take it off.
Yeah, it drives me nuts because apparently they think you only breathe from your mouth, not from your nose.
There's a lot of mouth breathers. And that's another episode. We'll have to bring you back.
Mouth breather.
So, you know, it's so important. The reason why with coronavirus, you know, it's so important to wear a mask is that transmission can happen not only when you're feeling ill, but mostly when you're asymptomatic. So that's the biggest difference with coronavirus versus a lot of other things. Like with influenza, we know like when you're feeling sick, you quarantine, you separate, you have medications that you can take for it. With coronavirus, when it came out, they were not aware that you could spread it asymptomatically. And then once they were aware, they said, you know what, wear a mask, because if you're walking around and you're just spreading this around to, especially to vulnerable people, you're going to put a lot of harm and you're going to spread. That's why we're, you know, the whole thing of being spreader events and stuff. People are walking around completely feeling fine and then just spreading the virus all around and infecting so many people. So, you know, you're breathing through your nose and you breathe through your mouth. It's not like you're like, okay, I'm just gonna, and then nothing's gonna come out up here. Like, you know, you gotta cover it over. Like, you gotta keep it up. And the thing that drives me crazy is when you go to talk to somebody and they're like, well, let me tell you. And then you're like, what are you doing? Why are you pulling this down? You don't pull it down to talk to me. And now that's even more like, you know, so that's why it's so important to wear it, to capture that, so that even if you're feeling good, you may have the virus and you could be spreading it to other people. If one person is wearing it, that's protection. If both are wearing it, that's even better, you know? So.
Absolutely. So one of the things we were talking about is in the myths. What about like the whole, this is just a new Tuskegee experiment?
Yeah. Okay. So I get it. Healthcare in America has been pretty crappy to people of color. I mean, gynecology in itself was based off of experimentation on Black women. That is why we have so much advances in gynecology because of that. There are a lot of different things that have happened in the past where it was unfortunate and it was bad to the Black and brown community. You didn't see white people running out to go and do all these things also, though. You look at the Tuskegee experiment, there wasn't like this one white guy in the line. Right. With here, you see so many people going into, communities of Black and brown trying to get this vaccine because they can't get it in other places. Mm-hmm. Like, come on, son. Like, just think about that. Like, oh, it's going to be Tuskegee, but you see all these other white people coming in here and getting it. So how can you really, compare? It's like apples and oranges. You can't. I get it. I get that there's a lot of mistrust and especially in America. Mm-hmm. There's a reason why Black and brown people have so much diabetes, obesity, hypertension, high cholesterol. And all of these things are putting us at risk of dying because these are high risk comorbidities for coronavirus, and so we need to take advantage of having a chance to get something that can save our lives,
Mm-hmm. I'm so glad you touched on that. Adina and I literally just had as a part of a conversation we had the other day when I said, well, that one thing about, and of course we discussed a couple of things that you mentioned about healthcare in the US and experimentation on Black bodies and, the PTSD that has been generationally passed down to all of us kind of being leery. However, and we had a jinx moment of like, we both said it at the same time. I was like, well, hell, if they was trying to kill us with the vaccine, though, we'd all have access to it. Like the reality of the situation is, it's a proven fact that our access, communities of color, Black and brown communities, just like everything else, in the beginning, disproportionate testing facilities and sites, now disproportionately lower numbers of access to the vaccine. And we also reiterated, folks need to remind themselves because we do live in a very self-absorbed nation. So sometimes, folks in the US act like we're literally the only nation on the planet. Folks, it's a global pandemic, as in the whole entire world, all the countries on the whole
the conspiracy planet is not happening to you.
Right.
No.
Exactly. Like, the folks in Italy were tired of wearing their masks too, but they had to and have to. Like, because that's one of my personal pet peeves with it. Like, you see, I get like the nervous eye twitch.
Yeah, exactly.
Like, that doesn't make sense. Like, I hear you and I feel you. It's just, you need to make sense to me. And what you're saying to me does not make sense. If this was designed to kill me, why are they making it so hard for me to get it? Oh, you telling me they're using reverse psychology with the vaccine. Like, we gonna make all the Black people want it because we gonna keep them from getting it like they're the new Jordans. No. No. Sorry, I just had to get that out because that drives me bonkers.
I have to deal with that and I have to talk about that constantly, whenever I've been helping people make appointments through the DOH site because I know how frustrating it can be. But I'm able to do it, and it's just, there's no secret trick. Like, you just keep clicking refresh, and then you end up just getting an appointment. But some people, if it's difficult to do, people won't do it. If you can't click just once and you get it immediately, like Amazon or, you know, Fresh Direct or something, they're not going to go and do it. So I'm willing to help people out and do it. But it's a shame that, you know, they feel that, well, you know, I don't trust it, I'm gonna wait and see. Well, UK got it before us. You know, Israeli had it before us. So that if that's the argument you're using, you saw it there. There were clinical trials done, you know, on this. That was done. That shows it. We know what are the, you know, more common side effects. We know what to watch for. There's a reason why they watch you 15 minutes afterwards. And like all of these precautions and things are putting it. We have a brilliant Black female immunologist, virologist who was helping in developing this in NIH, Dr. Corbett. Like, you know, like how much more proof do we need to keep putting out there before you know, you're like, okay, I get it. Okay, right. I trust it, you know?
Mm-hmm. And so, and I hear everybody saying like, oh, I want to see my family. I want to get back to hanging out with my family. We're like, well, get the vaccine if you want to see your people.
FOMO is real. FOMO is real. They will be out there once it's summertime and people like, I got vaccinated. I got, you know, and they're requiring that. And you can go out now. Everybody's like, okay, damn, I need to get vaccinated.
But on the flip side, we also don't want people thinking like that you take the vaccine and then it's all good. Like,
no. And that's the thing also. And I mentioned that in the video that I did also, was that you can't just all of a sudden just rip off your mask and just run out. It's not like streaking. We're not put into the Pacific Ocean.
Let's show the clip right now.
It's important for me to get the vaccine because communities that look like me, Black and brown communities, are getting hit the hardest. And we really have to get the word out that this is a safe vaccine. This vaccine is going to save lives. And this vaccine is extremely important for us to move ahead and to get beyond 4,000 people dying every day and, you know, families being torn apart and communities being devastated by losing loved ones. The main person I'm getting it for is for my parents. My mom is 76. She lives in Florida and I haven't seen her in over a year. My father is 77. He's had open heart surgery and he lives right down the block from me, but I haven't given him a hug, a kiss, or anything like that in over a year. I'm doing it for my patients because I have a very sensitive population and I would be really, really devastated if I somehow made them sick. For someone that's skeptical, I would say, you know, really do your research. Try not to listen to what you're hearing from, you know, neighbors and friends, especially if they're not in the medical community and they haven't really learned about the vaccine itself. I've had plenty of patients where I've had very long discussions with them and explained how safe it is, the history of how it was created. The COVID vaccine is definitely not a get out of jail free card. You can't just go out and all of a sudden be like, I'm free, and like just take off your mask. We're hoping that one day this will be a thing of the past, but it's not right now. Right now is the beginning of the battle and working towards getting safe and healthy and really, really moving forward and kicking butt and just, you know, getting over this. We really need to band together, get vaccinated. Please, everybody, really, really consider it, do your research, and actually learn how safe and how wonderful this vaccine is and how we can really make a change. Let's get vaccinated. Let's get past this. Let's try to, you know, win this fight.
There you go.
It's like you need to still wear a mask. There's multiple weird ways to fight a battle. This is a battlefield basically. And there's not one way to just win the war. There are multiple different ways and strategies that you have to take. And, you know, taking the vaccine is one part. Still social distancing is another part. Wearing your mask, washing your hands. Why can't people just keep washing their hands? Why is that something so abnormal? I don't get it.
You know, that was the thing. When the whole thing started, I said to my old massage partner, and she's white, and she and I have long had many conversations about how, you know, Black folks, we naturally are like, you know, white folks, y'all just really can be nasty. You see your cats on the counter in your videos when you're cooking, all those type of things that make us look at you and say, your hygiene's not up to par. So when this came out and I said to her, because we're massage therapists, right? We wash our hands 50 million times a day. So she's like, we wash our hands. I'm like, no, you wash your hands. I said, so here it came. I said, look, we have to have whole campaigns around washing your hands. What were you doing before now that you were not washing your hands?
Yeah.
This should not be that shouldn't have been that hard.
Well, I was commuting down to the city for 5 years. And I remember looking and seeing people wearing masks and stuff, and thinking to myself, well, that's just crazy. Why are you wearing a mask? And now I think to myself,
I should have been wearing a mask.
Now all I think are just particles blowing in my face all the time. I'm like, people were standing above me, just breathing down, literally their nose breathing down on me. Influenza, cold, adenovirus, every type of virus was just out there. So I'm like, that's smart. And if you look at the rates of like influenza and stuff this year, you see that it's lower.
It's low, right?
Of all of these things that we're doing, we're washing hands, we're wearing masks, we're separating, we're not being in tight spaces and stuff, And it doesn't mean that we're going to have to be like this forever and we're going to have to be, always standing 6 feet apart from each other. There was a Spanish flu that happened in 1918, We didn't think about that just 2 years ago,
Right.
We were handshaking and dapping and each other's face and everything. Things will go back, but you also need to adjust and change and realize like, yeah, you know what? Things are transmitted this way. Maybe we should tweak things a little bit, So, I mean, all of those things I think will help. But in right now in the current time, the vaccine is just a huge part that can help us significantly, and when you get the vaccine, don't think that you're 100% not going to get COVID. No, that's why it's 95, 94% effective with, Moderna and Pfizer, but it will help to reduce the risk of dying and getting horribly ill from coronavirus. The studies, the facts, the research shows it. The people who got the vaccine, if they were exposed and had COVID, had significantly less risk of dying and hospitalization. So if we can get the vaccine and keep people out of the hospital, keep people from having, pneumonia and all these other illnesses, it will help us move forward and get through this much quicker,
Absolutely. Absolutely. It's interesting that you would mention the things we used to do, and even the social distancing. I can't lie. I'd like to keep the 6 feet apart circles on the floor. Nothing would irritate me more than having, people invade my personal space, at the Starbucks. I'm like, hey, listen, the barista sees that you're next. Back off. I feel like I know a lot about your personal life because you breathe it so close on the back of my neck. So I actually... I like that a lot. I want to be close to who I choose to be close to.
I think there are a whole bunch of us that feel that way because we always used to be like,
I'm like, why are you all up on me?
Right. We used to like, you're a little close. Could you back up a little?
Yeah.
Right. And people be like, oh, I didn't realize I was, You'd be like,
I'm like, yeah, you did. You absolutely. Adina and I we're both, head wrap girls today. We both have really long dreads, like nearly waist length. And, people like to touch you, and I'm like, first of all, rule number 1, never touch a Black woman's hair under any circumstances.
No.
You might not, you'll snatch back enough.
Yeah,
I don't care if it's hers or if she bought it. If she owns it, it's hers. Don't touch it. So I'm like, great. I could be out in public and ain't nobody trying to. Yeah. I'm like, no. So I like social distancing.
No, I have a whole thing with a personal bubble and stuff, and I've always been there. The one that my husband always has hated, handshaking. Infectious disease, physicians have always talked about handshaking and how it is a huge spreader of illness. Transmitting from one person to the next. And, it's a hard thing because like I learned in residency, you walk into a room, you shake somebody's hand. That first touch that it transmits like a different feeling.
Mm-hmm.
Me as a physician, that's not like, doesn't have to be for everybody. I'm cool with a little hey or namaste.
Right.
I can't see myself going back to the Anja guy. I know that there are different ways that I can greet, patients and make them feel comfortable.
I think I'm probably gonna have to like embrace my Asian heritage, and I'm gonna be like,
exactly.
Start bowing.
I'm gonna be bowing everywhere I go.
I'm like, oh my God, all these Asian traditions make so much sense. Like,
Make a lot of
I'm not doing this.
Right, we need the mask, we need to bow.
Right.
Take your shoes off your goddamn
Thank you. We both no shoes in our house.
Gosh, yes. And every time people are like, really? I'm like, please take your shoes off. If you don't want to take your shoes off, put the little things on the bottom of your shoes.
I'm like, we have booties.
We have booties.
Yeah.
Put them on.
Especially having carpeting and stuff. So
yeah, like
people don't realize how much they're tracking into their homes. And I'm just,
yeah, it's really, really gross. Or as you mentioned earlier about the people on the subway that you thought were crazy, I was like, right, Michael Jackson wasn't as nutty as we thought he was.
Yeah.
and it's interesting. I was thinking about, as you mentioned, the decreased number in influenza cases, which does not surprise me at all. I remember seeing PSAs every time flu season would come around, and honestly, they weren't that dissimilar. Like newsflash, if you don't feel well, stay home.
Yeah.
But we also live in a society where there's a lot of people, unfortunately, that if they don't go to work, they don't get paid. So they went to work ill. Because people would die from the flu. Yes, they would, and still do, for these very same reasons. Like, you don't feel well, stay home. Rest up, protect yourself. It's just that simple. I think one of the things I found out about the handshaking thing, which really kind of skeeved me out, was how many times as human beings we touch our faces.
Mm-hmm.
And we don't realize how much we really touch our faces a lot. So I'm like, you just shook somebody's hand. You might be busy, so you're off to your next thing. You may not be like, pause, hand sanitizer, or boom, let me wash my hands. Let me just go on my, a bead of sweat, or you just ate, or oh, my nose is itching, or oh, is that an eyelash in my eye? The next thing you know, you have rubbed whatever they had on them all over your face.
All over. And into mucous membranes. And
open pores. Hi, you're talking to the germaphobes. Maybe we should change the name of the show.
That's true. I'm like, we are germ. We do.
You're such germaphobes.
But I think that this year, everybody is starting to become like that, though. We're all thinking, and we're so much more conscious of it. Even if you were conscious of it before, you're even more so now.
For sure.
Yeah.
People nasty.
Yeah,
sure. Like hyper conscious. I mean, I went on rants about, cleaning products and soaps and stuff like that. And I was like, well, what were y'all doing before? How come I can't get no Lysol now? How come I get no bleach now? What were you doing before? What were you pouring in the toilet before?
I was like, y'all,
like, you never cleaned the house before?
I was like, y'all didn't. I was like, clearly y'all don't know how much sanitizer y'all need or how much soap you actually need, because you didn't need 40 bottles.
Thank you.
I was like, 3 bottles probably got you through the entire year on a regular.
Exactly. But I tell you what, I did know. I knew where to find me some Dettol.
Right.
See, when in doubt.
There was always Dettol. And then I just realized, I read the bottle, like, it's been in my household forever. I read the bottle. I was like, you could wash your clothes with this. You could do this. You could do what? You could clean your tub. This is like forever. You could do anything with.
Really? It's like baking soda. Same thing. You're like, whiten your teeth, whiten your clothes, clear your clogged drain.
And some white vinegar.
Fresh in the refrigerator. Who knew? Let's go. So in that sense, it's kind of like, the version of ginger.
Cure all.
Cure everything.
Yeah.
Cure everything. Heal everything. Heal everything.
Yeah. So that's it. So folks, we want you all to make sure that you go out there and get vaccinated. We want your old folks, make sure you're getting them to go get registered, get vaccinated, take them, get on the computer, get their appointments for them. What was that kid? The kid in Long Island that signed up like 100 people in 2 hours. Did you see that report?
Yeah. Every day, I'm probably making about 4 to 6 appointments every single day for people. I put the elderly people in the community, my patients. Sometimes I'm on the phone with my patient. I was on the phone with one patient. He was like, I got it, but my sister hasn't been able to get it. Can you help her? Like, can you fill in this form? So while I'm on the phone with her, I ask her comorbidities, all the questions. Yes, no, no, da, 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 da. And then she's like, can you help my husband get it also? Like, you know, and I said, okay, ask him all the questions. Da, da, da. I'm like, at least every person that I make an appointment for, that might be one less person that we have to mourn. That's the way that I put it, you know? And no, people, it does not change your DNA. Stop it with that.
Thank you.
There it is. Yes.
Thank you.
It's an mRNA vaccine. We have DNA. You can't change it. It's like taking a piece from one puzzle of, like, you know, the United States and trying to put it into a puzzle of, you know, the Girl Scouts or something like that. Like, you can't, but the pieces don't mix. Like, it's not going to change your DNA. It's a little piece of code that your body takes, your body understands, reads out this code and says, oh, okay, let me make these spike proteins. These spike proteins that it makes, your body's like, wait a minute, what is this that you're making? This is foreign. We got to make antibodies to it. And then that way, if you are exposed to the coronavirus, your body will then be armed and know. It's like having an army and not giving it ammunition, or not having a battle plan. Like, you know, if you don't have a vaccine, you're just waiting to get something and be like, all right, we'll figure it out when it happens.
Right.
Versus making a plan and saying, oh no, we know how to stop you from getting into us and from infecting us, and we are ready to attack immediately and keep this person healthy and alive, so that they don't have all of those other things that happen when they're caught off guard and the enemy is sneaking from behind, you know?
Absolutely.
It's preparing your body. That's why you don't get as sick. That's why you don't end up going to the hospital. That's why you don't have as many deaths because of that, you know?
Got you. I heard an interesting analogy. I'd love to get your thoughts on it. There's a sister, she's a doctor down in the Charlotte area, and she was like, of course, she's like, I'm aging myself, and maybe some of you all, although not us, we age in reverse. But she was like, but some of y'all might be old enough to remember, and some of y'all might be old enough to remember. And if you're not, ask your mom and them, your auntie and them, they're old enough to remember when we used to take film, like to a CVS or a Rite Aid or whatever, drop it off to have copies of the pictures made. Then we get the little strip that was the little breakdown. And then we're like, oh, we look real cute in that one. Because back then, y'all, we had to really be experts at our selfies, because we would hold like an actual camera out from us and just go for it.
Didn't know what it looked like.
Didn't know what was going to happen.
Like cut off heads.
Like, you know,
this part of your head.
All kinds of craziness. But she said, you know, so you get the strip, you see it, you go, oh, I want more copies of this one. She was like, think of messenger RNA like that. It's a picture of a picture. Got it? It's not the picture. It's a picture of the picture. So for all y'all who like to copy and paste and crop and steal stuff from people on the interwebs.
Copy, paste, and steal that vaccine up in your body.
Right.
Yeah.
Copy and paste it up in there, you know, because we want you around.
It helps us recognize what the spike protein is going to look like. So just a little step back. So corona means crown, right? Coronavirus. So it's a virus that has a crown of these spike proteins. These spike proteins are what attaches to our body cells and then allows it to get into our cell, infect it, and use our cells to replicate itself. So basically infiltrating inside of our cells. If we know what this spike looks like, your body can fight it off and prevent it from attaching and entering into the cell. And that is what the spike proteins alone are not the virus. They are not harmful. They can't do anything to you. But the spike protein attached to the virus, when it comes and infects you, is what harms us. So it's just letting our body recognize this before it gets a chance to really take over our body.
Awesome.
All right, good people. I hope y'all got it.
I hope you got it. If you all by chance do have any additional questions or queries, please feel free to leave them in the comment section down below. We are also going to include in the description links to where you can go to get accurate, actual information that will be beneficial to your health. So as we get ready to wrap up, we want to thank Dr. Jilliann once again for taking this time out on a Sunday afternoon to rap with us and y'all about something that's really, really important and has been affecting all of us for the better part of a year and change. You know, and y'all, I just want you to remember one thing as you take your leave of us. You know, remember, you know, once you know better, do better so that you and the rest of the world can be better. We appreciate y'all. Thanks for coming through.
And in the 90s phrase, we used to say, get it? Got it? Good. So, Lo, I think that was a great talk with Dr. Jilliann.
Absolutely. Absolutely, Adina. And in our haste and excitement, we took for granted that all of y'all watching already knew who we are. Well, she's Adina.
And that's Lo.
Thank you so much for taking the time to hang out with us today. First of all, once again, thank Dr. Jilliann Elliott for taking the time to talk with us today. And we want to thank you for spending the time today. And we want y'all to remember, look, once you know better, do better so you and the world around you can be better.
Bye, loves.
Peace, sugar.